There is this, I think, general perspective that you and I, Kirk, don't need different healthcare. That is patently false. And we have some data to prove it. When 40% of a community is avoiding healthcare, that is a sign that what exists is not working.
Healthcare in America isn't just complex, it's chaos, with the information and power stacked against employers and patients. On Margin of Care, we set out to rebalance that scale. On this episode, we are chatting with the incomparable Liana Douillet Guzmán. As the CEO of FOLX Health, she's helping to reimagine care for a rapidly growing segment of the population, the LGBTQ+ community. Liana took a long and winding road before arriving in healthcare, serving as the COO of Blockchain, VP of Marketing at Axiom, and a board member at Glad, just to name a few. She's honed a skill set ranging from brand development to data-driven product innovation, team building to consumer experience. And today, we'll cover everything from evolving digital care models to retaining top talent and why building equity into the foundation of your health strategy pays off for people and for business. Liana, thanks so much for being here. Would love to hear a little bit about your journey to becoming the CEO of FOLX Health.
Thanks for having me, Kirk. I'm really excited to be with you. I'll be honest, I had been recruited for a few other CEO president roles and I had turned them down. I have this very clear North Star that when I take my final breaths, the two things I will care most about are, did I raise good people and do I have a good relationship with them? And I think being a CEO is in tension with that often because I'm on a plane all the time and I miss things that I don't want to miss. But I was really drawn by the idea of creating a better world for my children. When I was conceiving my son, I worked a few desks down from somebody who was also on an IVF journey, and their IVF was covered by our company, and mine wasn't, because she was married to a man, and I was married to a woman. And I have spent, I would say, the majority, if not the entirety of my adult life, going to providers who are willing to care for our community. But that doesn't mean they understand me or my specific challenges. They may be well-intentioned. And that creates a barrier from minute one in healthcare that prevents me and others in our community from being able to feel like we can be really open. And then that drives worse outcomes for us. And I think in talking to the team at FOLX, I realized just how broken my experience in healthcare had been. And I just took it as a given that that was our reality. And the ability to create a better version of that actually felt like it was in tune with creating a better world for my children and therefore tied to my North Star. So I joined the team just about 4 years ago.
So just for the benefit of those listening in, would love to just have you sort of share a bit about the kind of care that FOLX provides. And really, what are you considering for the future as well? So sort of a current state, future state on FOLX.
What I often say when I'm asked, like, what is FOLX? What are you doing? I start with the big picture, which is I actually think we're building the future of healthcare writ large. And for me, that future is patient-centered, whole person oriented, and community driven. I think in 10 years, we're going to look back and think it was crazy that we asked people to go to 50 point solutions for 50 disparate needs and that we separated mind and body, and that we didn't understand and appreciate and support that community is so important to our health and our well-being and can drive significantly better health outcomes. We are seeking to build a system that is fully connected. So as I said, whole person. We offer not just primary care, which spans everything from annual wellness visits to management of chronic disease, but also we offer talk therapy in 19 states and steadily growing because we understand deeply that mind-body connection is so important. And then we wrap that clinical care model in a community platform where people can access, high-grade content. They can connect with one another. They can join peer support groups. We have therapist-led sessions every week. We have workout sessions. So really this holistic approach to health and wellness. So that's what we're doing. We happen to be doing it for the LGBTQIA community. One, because it's a community that has been so wholly underserved by the incumbent model. But two, it is a large and growing segment of the population. In fact, it's the fastest growing demographic in the US. So 10% of adults in this country identify as members of the community. That number is 25% of Gen Z. So a full quarter of this next generation identifies as LGBTQIA plus and exists within a system that is so broken that 40% of people in our community actively avoid seeking healthcare. The problem with that is you can't actually avoid it. So what that actually means is that we have 200% higher inpatient admissions. And those inpatient admissions translate to higher costs for payers and significant losses for employers because people have worse outcomes, lower productivity, they have to be out of the house. So what employers get excited about for us, it's that 40% of people who are avoiding healthcare. Of the people who are getting healthcare, a full quarter are going out of network to access it. And so if you're an employer, to be able to get 40% of this community to actually access care preventatively, we may bring some of your costs up in the short term because people are actually going to go get their annual wellness visit done, whereas they had been avoiding going to any doctor for the last 3 years. But we can avoid them going to the ER in 8 months when they get hit with something that they can no longer deny.
Some employers might say, that's going to help me 3 years down the road. What if my people aren't at this organization anymore? Like, I help them, but they're helping the next employer that they're working for. Offering something like what you're all doing at FOLX to an organization like that, I have to think is having a compounding effect on attraction and retention as well. So people aren't leaving, right?
It totally is. And actually, I love when people ask me that question in the meeting versus sometimes thinking it and not saying it out loud. Because one of the statistics that I love most about our clinical outcomes is 40% of our members within 3 months see a quality of life improvement that amounts to 2 additional days per month for work and play. So if I said to you as an employer, yeah, you're right. Like it may be 3 years until we avoid that ER visit, but this year, I can give you an entirely new second February, essentially, for someone to work.
Yeah.
If you're trying to get through your workday and you feel depressed or anxious, I mean, your work product suffers. There's just no question about it. If I can get you to a place where you're feeling great about your life in 3 months, that is a massive productivity lift for an employer. So 25% of Gen Z is a member of this community, right? And it's not just, as you said earlier, Kirk, the 25%. Much of the rest of that 75% wants to work for organizations that is supporting this community. So even those that aren't members of the community feel strongly that they want to be aligned with organizations that support this community.
Does your user base want to receive care virtually? Is it important for them that they have optionality? Is it important for them that they have care in person?
I would say the vast majority of our members want to access care via telehealth. So our biggest states are California, New York, and then Texas, Georgia, Florida, right? So very blue, very red. And in the blue states, it's not because they can't access this care locally and safely. It's that it's inconvenient to do so. It is so much easier to hop on a call with someone. You hear stories about going to some of these clinics where you sit in a waiting room for 40 minutes and the doctor comes in 55 minutes after your appointment start time and they have their back to you the whole time because they're documenting. Versus here, we're doing what we're doing, right? We're looking at each other. We're having a conversation. We are on time. We can get you off in an efficient way. And so I think that's sort of one use case. And then in places like Georgia and Florida and Texas and Tennessee and others, it's a safety issue.
Yeah. People
don't want to be in a waiting room where they might be harassed or where the front office staff might be rude or where they're, we've heard stories about people going to get medications at the pharmacy and having a pharmacist very loudly ask them why they're taking this medication, make comments about them or their identity. And so I think it for a variety of reasons, our members really love having access to telehealth. And then we offer care navigation services. So you can go on to your payers, network navigation. You can go on to Psychology Today. And oftentimes they will have the ability to segment by LGBTQIA friendly providers. The difference between that and somebody who actually is expert in our community is vast, right? So the average clinician graduates their training with 5 hours of LGBTQIA training.
Wow.
Our clinicians on average have 10 plus years.
Wow.
And so for any care that we aren't able to provide because we are a primarily digital telehealth provider, we can get you to somebody that is, in your network who can provide care, and we tier it. So we can say to you, look, this person's willing to care for the community. We can't promise it's going to be the most affirming or expert experience, but they're, 4 minutes from your house and have no waiting period. Or this person we know is going to provide a deeply affirming and expert experience, but they have a 6-month wait. And we find that giving people the power to make those decisions drives a willingness sometimes to go to that less affirming experience because you feel like you had control over it and you're prepared for it.
I'm curious, do you provide as an organization training to doctors or recruit those who are already schooled up in culturally competent care? Like what role do you all play in helping providers sort of get smarter on this and get better on this too?
We started initially by recruiting the best of the best. It's a small universe of people who graduated from their clinical training and went out to specific clinics that focus on this community and got their training there. And so we went out and hired the best of the best. And then we've used their expertise to create training modules. So now we are not limited by our ability to continue to hire folks with 10 years of experience, right? Because realistically, there just aren't that many more of them out there. Yeah. We can leverage their experience to fast track somebody who is maybe, younger or earlier on in their career, but who has a deep passion for this mission and wants to care for this community.
Are you finding that medical schools are starting to get deeper in this and more thoughtful about this, or is it still a pretty major disparity in terms of what's needed in the country right now?
I would say by and large, I think there are forward-thinking organizations that are kind of leaning into it. But there is this, I think, general perspective that you and I, Kirk, don't need different healthcare. And that is what the masses believe. And there are those of us who are saying, that is patently false. And we have some data to prove it. When 40% of a community is avoiding healthcare and 25% of those who are seeking healthcare are paying out of pocket for it, that is a sign that what exists is not working. And I think what's going to happen is you're going to see this sort of, it's a looming crisis. And eventually people are going to open their eyes and realize that suddenly a quarter of the population does not fit within the incumbent model. And the traditional system is wholly unprepared to meet their needs. Now, I will say we have been really fortunate. We have been able to build partnerships with payers that are not just getting our providers in network. We get preferred rates because they recognize that this care, even if the CPT codes are the most often used codes in medicine, the way we provide that care is specialized and they reimburse us accordingly. But they also, a number of them have gone on to pay our membership fee, which is pretty unheard of. And so I think you're sort of seeing a tale of two cities across the board, whether it's payers, employers, medical schools, as you asked. Some see it and are going to be ahead of the curve and they will benefit greatly from having been so. And a number of them are just continuing to sort of sun themselves on the beach, not realizing what's coming.
Yeah, I think it's actually a really awesome segue, right? Like a lot of times you hear that like employers are typically the ones that actually sort of are on the forefront of innovation. That's where a lot of the cool stuff has come over the last several years that are really impacting employee lives, costs, et cetera, downstream. So you all started out, I understand, as direct to consumer. Walk us through the shift to more of an enterprise focus, including sales to employers now, and sort of what you're seeing in the employer market as you're out pitching to employers and to their brokers about this population.
So we started as a direct-to-consumer offering because we wanted to make sure that we were an offering that people wanted, right? We wanted to make sure we weren't a solution in search of a problem and that we were building something that was really going to materially improve the lives of the community we wanted to serve.
Smart.
And I think there's no better way to do that than to say, look, people are willing to put up their own money for it. The goal has always been the same. We want to care for this community. We want them to have access, not just to what their straight cis counterparts have had access to. We want them to have access to something even better. And we felt like the best way to do that was to build directly for them initially. And then you reach a point where, you sort of can't avoid the reality that most Americans access healthcare through their employer-sponsored insurance. And we want to provide care that is accessible. And the best way to do that is to get in network so that we can bring costs down and people can access the care as inexpensively as possible, while still affording us the opportunity to pay our clinicians, not just a living wage, but pay them well for their expertise. I will say we were pulled into employer sales sooner than I think we had anticipated. And a lot of that came from, employers, sort of two big use cases that we saw. One was people who were paying out of pocket who went to their HR teams and said, you've got to figure out a way to offer this. Like, it is not fair that I have to pay out of pocket because you don't offer it. And I think employers realistically spent a lot of time paying for inclusive benefits only to find that they were inclusive on paper, but not in practice. And you'd have people walk in and say, look, let's go through the navigator together. Let's look for LGBTQIA competent providers. Oh, there's one in the whole state and they're not accepting new patients. So you can't look at me and say you offer inclusive benefits when I can't actually see the one doctor in our network that theoretically checks that box. The other path is just a realization that, particularly for trans folks, employers were feeling very flat-footed. Like they were going out to their payers and trying to have a conversation. And I think realizing there was a lack of expertise across the board on this community and how to care for it well. And I think the truth is most HR professionals go into HR because they care about people, right? Like they, yes, they need to make the numbers work, but I rarely hear people speak so passionately about the employee experience than the HR folks in any given organization, right? And so I think they looked at this segment of their population and felt like, I can't go to bed at night knowing that we don't have a way to care for them. So those were the two sort of entry paths early on. Now we're using a more traditional sales model where, we partner with care navigators and they sell us as part of their solution. We partner with the WTWs and Mercers of the world to sell into their employers. And then we do have some direct employer sales.
What is the typical pitch to employers and to consultants or brokers that might not be aware that the population is as large as it is and that the population is really in need of a different type of care?
We try to balance narrative and numbers. Is what I would say. So I think we're really explicit that this is not a DEI solution. Now, let me pause and say, that's not because we don't believe that DEI is important. We believe fundamentally that organizations that have diverse, equitable, and inclusive workplaces are going to outperform those that don't. But at the end of the day, what we are offering is a solution that can help you keep your people healthy and happy and productive. We can help you be attractive to new recruits, and we can help you be a place that people want to stay once they're working for you. Save money, drive productivity. That is the pitch. And so some of it is on the narrative side, sharing some stories. Because I think if you don't live in this world, it is very easy to believe. Like I think about my straight friends, and one of the most beautiful things about them is they don't think I'm different from them. But it is deeply important for me to tell them stories so that they know we are. Mm-hmm. And then it's sort of leaning into numbers to support that story, right? 40% of people, one of the statistics that we share with employers, which I think is mind-blowing to them, it was to me actually when I learned it, is nearly 50% of employees are not out at work. So when you think we have a system that's supportive, you have to pause and acknowledge that if nearly 50% of people don't feel comfortable being who they are at work.
That's not supportive.
What's supportive?
Yeah. So I worked at one of the larger consultants for a long time, and one of the phrases that always sort of stuck with me, and I think it's a perfect sort of wrap on sort of how you were describing your pitch right now, is sort of balancing economics with empathy. And I think for different organizations, different points in time, maybe this year the balance needs to maybe tip a little bit towards economics, but as things sort of straighten out or organizations have the ability to shift more towards empathy. Like, I love the fact that you guys could come in and tell the narrative that sort of accomplishes both sides of that. So, you mentioned the health plan side, you mentioned you've got some care nav partners right now. Like, how are you working with them right now to provide in bringing solutions like FOLX to employers, to employees? I'd love to hear just some examples of some of the partnerships that you're working with right now, or how those partnerships work.
It's a very boring contract revenue share model, basically. But a lot of it is, it's interesting. Employers are coming to them and say, so I think one of the things that's happening right now in this political moment is there is this sort of very public move away from this community. What I'm finding interesting is that privately companies are saying, look, we're taking this public stand because we want to protect ourselves against blowback from the current administration. We want to balance that public stance with a private support of our employees, right? You look at some of the biggest companies out there that are taking some of the most vocal stands a lot of their employees are members of the community, and arguably more, like a higher percentage than even is represented in the broader population. And so a lot of them are already working with these care navigators, and they're saying, look, we've been working with you for 4 years, but we need a better solution for this community. What do you have? And so a lot of it is these care navigators are getting inbound interest from employers and then bringing us into the conversation, and then it's a co-sale, like often, and it depends on the client. Like sometimes the client will come in to them and say, no, we know about FOLX. We want them, just paper the deal. And then it gets handed over to us from an implementation perspective. Other times, hey, we're having this challenge. What solutions do you have? And then we go in and we talk about it, and we partner with the employer to talk about how we might be able to support and meet their needs. So in some ways, I think of it as just, we're a very small, lean startup, and it allows us to leverage a deeply experienced set of sales leaders on our behalf so that we can drive, greater awareness and scale than we could push out into the world on our own.
Yeah, it makes complete sense. So, you mentioned the administration, et cetera. So HR1 was recently passed. It's expected to kick about 17 million people off of health insurance over the next 10 years. So the healthcare sector, though, it's bullish that they can reach people through self-pay, patient payment programs, other forms of engagement. How's FOLX thinking about reaching patients at this time and ensuring that they can get access to medications, like hormone replacement therapy? How are you all thinking about that right now?
Yeah. Look, I think it's a really deeply troubling moment for this country. I think it's really scary that so many people are going to lose such deeply important safety nets. For us, the reality is we've been serving people outside of the traditional system from the beginning. The direct-to-consumer business is still our biggest business. I think sometimes you think about companies that start as direct-to-consumer and then move into the employer or payer space, yep. and they do so because their direct-to-consumer business isn't sustainable. That's not the case for us. We actually have a really strong direct-to-consumer business. Being in network and selling through employers drives access, but sure. Direct-to-consumer will always be a big part of what we offer because we want people to be able to access us regardless of employment status. So in some ways, nothing will change for us because we're so accustomed to existing outside of the system. We also have always had things like we have a queer care fund. And that, we partner with organizations who help fund that and are able to provide care to folks who might not be able to afford it otherwise. And so we'll continue to invest in that. We're also lucky, we don't take Medicare, Medicaid. So folks who are going to lose coverage there, it will not impact. And we have a fair number of Medicare, Medicaid patients who are cash pay on our platform because they couldn't find the care they needed within the Medicare, Medicaid ecosystem. So I think in a lot of ways, it's going to be sort of business as usual for us.
That's awesome. You guys almost had, not that you had the foresight, but maybe you had the foresight to sort of set up a model that can continue to be really successful, even though there's changing times just, countrywide too. So I've learned a ton. I'm excited for our audience to listen in, like your perspectives, your point of view, just some of the incredible statistics that you raised and the work that you're all doing right now. So thank you so much, Liana, for taking the time today.
Kirk. I really appreciate the time. Thank you so much.
If you're liking the conversation, be sure to subscribe so you don't miss future episodes. And if you've been enjoying Margin of Care, please leave us a review on Apple, Spotify, or wherever you listen. If you've got feedback or questions or something you'd like us to cover on the show, send us a note anytime at marginofcare@getgarner.com. We'd love to hear from you.